Hi Chantel, my name is Dion. Welcome to the Disabled People's channel. Do you want to tell me about yourself, please?
My name is Chantel. I'm the founder of Global Epilepsy Connection Rwanda. It is an organization which fights for the well-being of people living with epilepsy. It started in 2010, and we have already having other affiliation international, and I think we are going to the right direction, and we are members also of the Epilepsy Alliance Africa.
What is your organization about, please?
It's about people who are living with epilepsy. We improve their own well-being. We work on the prevention of the disease in maternity infant, and also we spread advocacy and awareness through different school and residential community.
So is it all disabilities or a particular?
Yeah, it's disability because epilepsy is excluded in Africa, part of the disability, but it's also mentioned by the OMS, the WHO, that is also quantified in part of the United Nations Convention for People with Disabilities. As autism, epilepsy, mental health, they are part of disabilities too.
Is it run by volunteers or is it a government-based scheme?
No, it's run only by volunteers, family of people suffering for seizures, and it also include other people who have professional basic knowledge of the development field, example, association, NGO, stuff like that.
So if it's run by volunteers and you have no funding, how do you get your funding?
I get my funding because I link it to the government, and I show also what the government may improve on management gap of treatment, and the diagnostic need to be close because some patients may be before they be travel like 8 hours to get an encephalogram machine, EEG, to scan the brain. But now we managed to make that facility to many centers in Rwanda.
And many of your the children and babies, are they able to get the drugs that should be provided for them?
Yeah, they have received it because Rwanda now has improved its quality on free health care.
Chantel, how do you find people in your country? What's the attitude towards disabled people?
Now in my country, we have also a good governance which look after the right of people with other disability like blindness, deaf, also albinism. And now in Rwanda, in case you laugh against someone with albinism, is something which can be charged by law. You may have a penalty and classify as someone with a bad attitude in the social behavior. Example for epilepsy, they have not yet started that campaign very well for people to understand because they call it igichuri. That means it's like someone who walk head flip. They need to change that name to something like in Swahili they call kifafa, which is a brain trigger. But here it needs to change because it keeps stigmatized patients to be nominated like people who do not have a.
So is there any prejudice towards disabled?
Yeah, majority of them, they are jobless, they are isolated, they don't have a good quality life. Many women do not get married for that. And even parents who are professional, who have even average skill, do not want even people to mention that the kid have epilepsy in public place.
I think you'll find you get that in lots of countries, really. You can have it here in the UK. Some people have never seen anybody with having a seizure, for instance, and they find it hard to understand and even what to do and maybe help. So I think it's around the world, really. I mean, you have to be educated, as you said, as in the condition. How do you find COVID in your country? How have you been coping with that?
Yeah, we are very disciplined because we have a good leader, like the president of the country is a great leader. But if you see, example, you cross to DRC, many people who have a charity, they depend on overseas debts. Like last time in the COVID, they give me a finance of 5 tons of food. In other community close to Rwanda, example Congo, I didn't see that happening, despite people be dying with sudden death due to low nutrition.
We have that here. We have help with food parcels, whether it be from the government or through what we call the food bank. Do you have masks? Do you have the equipment needed? Hand sanitizers and masks given to you?
Yeah, it's under government rule. You cannot escape mask. You cannot go in a public place without mask. The same day they find you have it, they may test other people in your area and bring them to the isolation facilities. And from that, they test you after 2 weeks and then they release you. Yeah.
Hi, what medications do you have that's helping with the virus at the moment?
I think it's from Oxford University, but it's a cortisone, and they use it to treat some. But in Africa, generally, many people are using chloroquine now because they believe in it.
Okay.
And it treats patients fast, and many patients recover in 5 days. Many people, even they have other disease, heart attack or heart disease, kidney disease, they are using it and they become free of COVID.
Yeah, we have dextromethasone that helps us in this country that are given to the patients now. So they have a better chance of survival.
Yeah, even here we have a better chance. We have only a report of 5 deaths.
The people with epilepsy, do they do what we call shielding? Have they had to stay home?
Yeah, they stay home because they don't have job actually. Majority of them, you can say 80% of the patients are jobless actually. People who be helping them, they are fed up because they have to start by their own kids. And sometimes they reject them. They say, go to someone else. Now I don't have a job to keep you in my house, find another person to help you. So those persons, they feel rejected. They feel stigmatized for the poverty coming. And I see by my eyes, many youth are committing suicide because of lack of hope for their own future.
That's where the discrimination with the disability comes in, because lots of people can be out of work or they've been in work, and when their epilepsy has been seen, they've lost their job that way. So it's very stigmatized, really.
Yeah, but the good about the UK maybe is about they can even take them in charge, the government themselves, by give them a job seeker allowance or a disabilities allowance. But in Africa, the country is supposed to take care of them completely. And you see majority of them, when they consume those heavy drugs, they lost hope. They see the body is weak again, more weak than before. And majority of them, sometimes they abandon drugs to go to the witchcraft to find solution out. And they meet sudden death because they stop the drug without the doctors about.
So they'd go to witchcraft, you said. So is that legal?
Yeah, it's not legal, but you can't stop it.
Because it's what's believed, really.
Yeah, people believe it's a ritual. It's an African ritual. If you saw the list of the Epilepsy Alliance Africa, you see all the name and the meaning. It means devil, it means witchcraft, it means like someone possessed by demon, high spirits, stuff like that. It's not a Holy Spirit, it's a demonic spirit. So them, what they do, majority of them, there is traditional doctors who also treat them. And there is also some sort of a fire. They can put a knife on the fire and they put like that on the head of a patient. You see, they use that practice to allow that migraine not to come. the trigger not to come, but it's still to come.
But that's also
And
causing burns, though, isn't it?
yeah, they do it.
And great pain.
A lot of pain. Even you see the Sudanese population in the village, they have stuff, some romak. So it's a part of routine of traditional African people to keep safe your family, to keep.
If they're going for the witchcraft, what is the survival rate?
The survival, normally, the witch doctor does not have a knowledge what is that molecule is doing for that patient. How example, Depakin can help a patient to survive and decrease his life expectation. So then they can tell them, after do that, take this thing in the morning, put it in the water, drink that water, and your seizure, you'll be free of the seizure, believe me. First, they believe on him. I have another seizure. Okay, come back, I have another medication. I have like the way you go back to your doctor to say, change me for Depakin to gabapentin, to other drugs, stuff like that. So it become like a routine, a surgery.
Yeah. Okay. Is the witch doctor legal?
Yeah, they are legal. People have rights to contact them. It's not passed on the law that is illegal. It's legal because even a woman who cannot give birth or have a complication may go to see a witchcraft to find a man or to find a baby.
And is that successful? Would you say that a lot of people that
I don't believe on it.
You don't?
I don't believe on it. I
Okay.
think it's just a perception of someone with ignorance. Yeah. Discrimination exists because they don't see a clarity of a future production of that children. These parties go to school, they don't see him having a job because the employee may not employ him with the seizures, example, and there's no protection policy for them for that human resource. And another thing is, example, at school, example, those children who can take drugs, but they have a resistance to those drugs, and the seizure may not be controlled. Sometimes they told them to stay home. It's better to stay home.
Would you find that in all disabilities, like other disabilities? How are children in wheelchairs? How are they treated?
Yeah, also the children in wheelchair, despite the law be passed, some people still attach a stigma to their own mother that they are possessed. Sometimes some people blame the parent for the disability of the children. Example, a mom who have a kid with autism, they blame the family of the mom. And they keep saying that it comes from the one family. So the men need to leave that woman. That's why you see many parents, if they have a baby with autism, epilepsy, or mental health, they don't want that baby to go out, interrupt in public. They keep the baby isolated at home. In case they go to a public event, like a wedding, they don't carry those baby with them.
That's very sad, actually, because that's really prejudiced when you think about it, isn't it, towards a disability? And then that must leave the child or the young adult or even the adult thinking that, you know, that what they have is really wrong, and that's quite harsh.
It's very harsh. It's very harsh. Even the one mom suffer a lot because they get blamed from the family of the men that this thing come from your background. So stuff like that. Yeah.
We're here on a channel, on the Disabled People's channel. We've done videos of autism and epilepsy. Does it help your community and people in your country if they could see how other countries deal with these conditions, i.e. we're not prejudiced towards them, they are helped? So
yeah, that's why
people in your country find us knowledge from around the world very helpful.
Yeah, they are starting to get the knowledge because when I came to them and I present myself like someone with epilepsy and create that organization GECO, people start to wake up in mind and see that people with epilepsy also can be also active in the society and they can bring something positive. That's why we came after the Congress of Uganda with the International League Against Epilepsy and the International Bureau for Epilepsy based in Dublin, we create sort of thing which called Epilepsy Alliance Africa. And I'm part of it. So we are trying to remove the treatment gap, the management of the treatment gap, to make practitioner doctors be associated also with all organizations which are fighting for the well-being of those patients. And that's why we see now tomorrow, example, if you see there is a Kilimanjaro trip organized by Kenya Youth Move, which will be to a Kenya Youth Move is a organization for youth who are suffering for epilepsy. So for that, you see there is a young man, ambassador of others in Africa, who will ride from Kenya, Nairobi, to Moshi, Arusha, and climb the Kilimanjaro. And then he will be the first to put the flag to say epilepsy need to be removed as a contagious disease, and epilepsy need to have also a power in the society governance. They need to have a budget to support those people. They don't need only to provide drugs or primary care, but they need also to give them a well-being for future, like a job, integration policy on development.
That's amazing. And they are climbing Mount
Kilimanjaro. Are climbing, and we welcome your disabled channel to be part of it. It is a good challenge, but I think the airport will be open. There's no need to fear COVID. In Africa, we treat it.
Talking about the witch doctor again, people are still believing. How far back does that go? Why is it still out there?
That's why our movement in Africa is to bring also those witchcraft doctors, to teach them about what is epilepsy. They consider not to live their own walk, but to learn that epilepsy is a trigger, is a brain disease, is a disconnection of the neuron, and is something which may be well treated in advance and get a cure. Some of them start to collaborate with many hospitals now in Africa. That's what the International Bureau for Epilepsy in Dublin, in Ireland, did. They bring them back to us, and then they start to learn about it. And I think majority of us, we try to convince them to abandon that practice and then to be member of organization. And another thing we need to develop for Africa is about telehealth. We need to give more training to practitioners, doctors, nurses who follow patients, and get to at least an accurate level of a diagnostic and also prescription. Because sometimes you can see someone drink the repeat prescription for more than 6 years without get control.
Is there a divide between the rich and the poor?
The problem actually, this country comes from a massive genocide. In 1994, they killed almost all our family with a machete and slaughtered them. So most of adults who are diagnosed with epilepsy, they have example wound on the head, example they cut their own neck, but they survived, and that bring seizures and other mental disability like a post-traumatic disorders.
Yes.
We know that there's the gap between, because we came far from develop this country. Example, actually, we are the one they call the best in Africa in governance, etc., etc. But we still have a lot to do to remove that gap between rich and poor, because the country is poor. It doesn't have enough resources. We develop things, but I can say the rich people maybe 20% of the population. 20%. The average rich, that means people who can have hands meat, breakfast, and 3 meals a day. But the poor, they are high in numbers. That's why we integrate children who are suffering from seizure in the ECD program, the nutrition program, the National Nutrition Program. So in each center of a village, there is a center to give them food. And we are trying to develop the microfinance development for them. That's why with Gecko Vision, we took every clinic center and we implement a cooperative group, and then they start to cultivate Irish potatoes, and from that they are now in good health income. But we need now to exceed limits and cover all country. But in all country we have a statistic of 600,000 patients. But those I'm helping, they are reaching only 350
Oh, that's
patients.
quite low.
It's very low, it's unfunded. Yeah. Unfortunately, it's unfunded. It's a program which is not well funded on matter of structure of income generating, stuff like that. Thank you for inviting me for this beautiful channel of Disable. And I encourage you to be part of the African Alliance, Epilepsy African Alliance. We may even have a presentation in case one of you who is a presenter of the research or presenter of the good you have done on behalf of your community, you may also integrate yourself and ask us. We will put you through, and then you may introduce yourself